Hello, everybody. So, tonight I'm going to introduce and interview one of my other friends, and his name is Eduardo Mahn, and he's from Chile, and he should be joining us soon. And we're going to go into some of his topics, what he likes to talk about. He's going to be joining me at the Orofacial Club meeting in Miami in a few weeks, and his research is amazing. Also, just one of the nicest guys you'll ever meet. So let me see if Eduardo's coming in here soon. Let me see if I can go live with Eduardo. Here we go. Should be coming in. Hello, everybody. Jonathan from Vancouver. What's up, man?
Hi, Kyle.
Hello. Let me see. He's coming in.
Can you see me or not?
Yes, you're good. I can hear you good
Yes?
too.
Cool.
So welcome.
Can you hear me well?
Yes.
Yeah, thank you.
Okay, so why don't you introduce yourself? Why don't you say your name, where you're from, what your training is, and then we'll get into it.
Yeah, well, my name is Eduardo Mahn. Yeah, I'm from Chile. Well, I've been all over. I did my doctorate in Germany. I worked in Switzerland for 2 years for Ayurveda, then was in the Middle East and came back around 8 years ago, back to Chile.
That's right.
And I met you, I believe, I don't know, 2 or 3 years ago?
Yeah, it was. So we met through our good friend Christian Coachman, and he introduced us because we were both thinking about the face, along with
Yeah,
our other research colleague Bruno Pereira,
yeah,
and we met in New York a few years ago when Christian introduced us. And I
yeah,
think between me and Bruno, we really just instantly became friends, and we
yeah.
instantly started doing research together. We've published a few articles now, and have a few more on the way too.
Exactly. There are many more coming. Yeah, yeah.
Yeah,
But time is scarce. I mean, I wish we would have more time.
yeah, right. Yeah, it's we have all the ideas, and it's the execution when we're balancing family and private practice and research and universities and lecturing. I know that you're very well known internationally, but you may not be as well known in the US, which is why I wanted to do this interview.
Yeah,
So, why don't you talk about some of the things that you like to speak about and tell me some of the
yeah.
main topics?
Well, you mean generally, or what we're gonna talk in 2 weeks in Miami?
Let's do both. I mean, when you're lecturing, because I see you lecturing, you're in Asia, and you're in Australia, and you're in Europe, and you're in South
Yeah,
America, and you're all over the place. Dubai, I mean, you're everywhere. What's like 80% of your lectures about?
yeah. Well, it's a very funny story because I started actually, well, kind of. Yeah, I study here in Chile, and then I started in Germany doing my doctorate in implantology. So I started with the basic surgery training. And then over the time, I realized that I was kind of more interested in the aesthetic part of the implantology.
Right.
And this is how, after finishing, I moved to Switzerland, where joining Ivoclar, which is one of the main companies that produce ceramics and composites, kind of really grew in my heart. And kind of, yeah, you grow with your patients, you grow in what you like to do. And this is how my practice developed and what I'm doing on a daily basis. So, and this is how I was interested more in these topics, doing research and treating the patients. And at the end, what you like to do is what basically works better. So, from doing really crazy surgeries with people at the university and in the practice in Germany, I kind of became a more a delicate one single implantologist doing a prosta and resto.
Yeah,
Yeah,
that's
that's
cool.
basic. Yeah, that's basically so. Kind of, I developed myself based on what the patients were asking me. So I don't get, for example, the dentist patients. We were
Mm-hmm.
talking. Probably you also know him. Probably Anas, alum
Yep.
from Abu Dhabi.
Yeah. Yeah.
Yeah,
He went to
once we had.
USC. He went to the same school. He was
Yeah,
doing
exactly. Yeah,
pros while I was there. Yeah.
yeah. Well, it was really funny. He was talking about the process that he does, and he gets really a lot of dentalist patients.
Yeah.
And I said, look, the last time I did it was when I was in Germany 10 years ago. And I
Yeah.
don't get any dentalist patients, just kind of single implants. Yeah, some people might need more than one implant, but generally single implants and really taking care of that it really looks good and remains for a long time.
Yeah, and that's interesting because I think that the single implant patient, people think of those as the easy cases,
Yeah,
and oftentimes these are the ones that get screwed up, right?
exactly.
It's like, oh, it's just a single one, it's back tooth, it's not aesthetic, no
Yeah,
big deal. But when you can do every step correctly and research driven, when you understand the tissue and the bone and how the materials are working, I know that you are really, really good at materials. I think you can get really nice outcomes even if it's on a single tooth. And I'm similar to you in that I love doing single tooth implants, whether it's posterior, aesthetic, non-aesthetic, whatever, because I think that they're overlooked as being simple cases.
yeah, that's
And
true. Yeah,
they're often perceived as being too easy.
yeah,
So
yeah, and the
why
same
don't you
happens with sorry, and the
sorry, go
same
ahead.
happens with the other topics. So what we were talking, the same happens with I don't know with composites, with a class 4 or with a single tooth that needs a direct veneer or a single crown. I mean, there are things that now there is a clear trend of treating or over treating people, and we see a lot of that in social media that
Yeah.
12, 20 veneers are presented, and of course the more you're changing and the more you prepare, it tends to be easier to match. But this is how the last post that I have done in my Instagram account, which is Eduardo Mahn, basically try to discuss the issue that we have been discussing together also
Yeah,
in recent
privately.
times.
Hmm.
That, of course, is not, if you change a lot, it's easier to match. But whenever you really get the face and the smile together, maybe changing with ortho, with aligners, and with probably with the intervention of 2 teeth or 4 teeth, you might get really a fantastic result. But it tends to be more difficult than changing a lot.
Yeah, for sure. And when you and I and Bruno and Christian, when we're looking at cases for facial flow, oftentimes those central incisors and the wear facets that they may have and the incisal edges can make a huge difference. Just those 4 teeth.
Yeah, yeah. Or the two centrals,
Yep.
or yeah, or a patient that have the canines too dark and the laterals maybe not perfectly aligned, but good enough from the functional point of view. And the two centrals just with 2 direct veneers that were not looking that great. And this change of these 2 centrals with 2 beautiful veneers and following the flow of the face might make really the difference.
Yeah. So why don't you tell everybody what you're going to be talking about at the Orofacial Club meeting in Miami in a few weeks?
Yeah, well, oh, that's a very nice thing that it would just accept it. The main topic is about how the smile is perceived by people. That mainly we thought that the gummy smile is something that is not that prevalent, that needs to be treated. And
Yes.
what we proved was that is the opposite, and that correlates pretty well with your topic, which is the lip factor.
Right.
That basically it is natural to show gingiva, it is natural to show teeth, and it is a sign of youth. And the trend in aesthetics was the opposite, that people were injecting fillers and making the lips too big, and that they were not showing any teeth and gingiva, and at the end they were looking older.
Yeah.
So it kind of correlates really clean with what you're doing, that is trying to show that showing teeth and gum is natural, and you're shortening the lips so that people can show more and having a natural curve.
Yeah, and you know, when we first started discussing this topic years ago, and you had really, this was really your baby,
Yeah.
I loved it because it went along so well with everything that everybody in our research group was talking about, which was, of course, minimally invasive treatment, thinking about the face, considering the face, and not just thinking like this. And it really allows you to understand someone's face better and understand how the face changes as people age. And I think
Yeah.
this is something that not very many dentists think of. We think of how the teeth age, but we don't think of how the face ages.
Yeah.
And whenever I explain, you know, your research and our article that's coming out in some of my lectures, people get it. They understand it. And the great thing is that it's going to save many people from thinking they have to get, or dentists thinking they have to do crown lengthening on a patient if they show 3 millimeters of gingiva.
Yeah. Yeah, and basically, well, that's exactly what we showed, that showing 2 millimeters is quite normal, and it's more than 50% of young females. And of course, well, we knew that females are showing more than male
Yeah,
patients, and it basically that, well, we did it in the young population. Of course, these were our students that are between 18 and 28 roughly. So what we have to prove now is exactly what you said, and how the patients are aging, and we need to find a population that is older, and then try to correlate the classic number, which is 1 millimeter less per decade, which is what we all think that is truth, but we don't really know.
yeah,
So that's the next topic that we have to cover. But what is clear now is that with the amount of people that we did, we're around 400, if I don't remember wrong. That's a really fair number to show that showing gingiva is a sign of youth, and this is normal.
exactly.
Doesn't necessarily have to be treated up to a certain number, which is probably 2
Right.
or 3 millimeters.
Yeah, yeah, and I think that's kind of our main idea, is that everyone thinks maybe 1 millimeter. If you show 1 millimeter of gingiva, that's good. And we're saying you can show more, but I think something that Christian always was very good at explaining was oftentimes it's not the amount that shows, it's the disharmony of the tissues.
Exactly.
Which is so important. We see so many smiles of people that have typical gummy smiles. They may show 5 millimeters of gingiva, and these are people that you look at and say, oh my gosh, they have amazing teeth, they have a beautiful smile, it goes so well with their face. And I think that the deciding factor ends up being if there's true maxillary excess or not.
Yeah, exactly. That's exactly the point. And the other point is that we thought that was not normal, because most of the studies were done with pictures in a university environment, and it's very difficult to bring people to laugh naturally when you are exactly in that environment. And this is exactly what's happening to most of the dentists whenever they say to the patients, okay, guys, look, now smile, please, and give me a smile. And of course, it's exactly what you don't get.
And that just happened. And look at how gummy I am, too.
Yeah, exactly. Me too.
Yeah.
Yeah, well, we are both young. I'm a little bit older than you, but we should be considered young for an average population. Yeah. But anyway, what was
the youth is a big thing, too, what you're saying, because we both have patients that come to us and want to show gums because they know that young people show gums.
Yeah, exactly. And the thing was that the studies were done with pictures, and it was very difficult to bring people to laugh. So whenever we make a video, and this is what we prove basically in this study that is about to come at JPD, that whenever you make a video, it's going to be much easier to get the spontaneous smile, which is the right one to diagnose whatever we're planning to do.
Right.
And basically just take a 15-20 seconds video, and the people will laugh much easier, and you're going to have an unlimited source of pictures because of the frames per second that modern videos have. And even with an iPhone, you don't need any fancy equipment now.
No. Yeah, I always tell people, you know, in my lectures, if you have an iPhone and some natural light in your office, you don't need anything. If you don't have natural light, you can get a very cheap light that will help an iPhone video be really, really nice.
Yeah.
And
the lights
you know,
are getting cheaper and cheaper now.
Yeah, and I have on my lectures iPhone videos that look great. You know, I have a simple ring light, like maybe, I don't know, $100 or $150 ring light, and an iPhone, and that's it. And it's good. And I can go frame by frame by frame and wait until it goes as high as it possibly can.
Yeah.
And that's when we analyze the face. That's when we analyze the smile. And I love what your research brought, because it's one more layer to this minimally invasive way of thinking, this natural, organic way of thinking, understanding different ages and how there can be beauty at every age. It's really important.
Yeah, definitely. Yeah. Yeah, now, and the other thing was basically, thinking about the same. We did it around 2 years ago, I believe, that we published that about the tooth forms and the correlation with gender.
Yes.
That we thought that teeth will be different based on the SPA theory from Fresh and Fisher, that you had sex, personality, and age. So certain features, depending from the age, from the personality, and sex of the patient. We proved that. There was a very nice study done in Kiel, Germany, around 12 years ago, but that was done with 120 persons. We did it with around 400, and we came to the same conclusions, that basically there is no correlation, and you should not, or well, if you want, you can, but there is no proof, and there is no sense of making rounded teeth for females and square teeth for male. That doesn't make any sense. There is no evidence, and there is no scientific background to prove that.
Yeah, and this is an important concept, because it's just one more layer that we can say, okay, this is research backed now, to know that we don't have to make round teeth or square teeth or whatever.
Yeah. And one of the main things that people have not realized when reading the paper is that we also prove what Christian was saying since a long time, based on the smile donator concept, that you can give male teeth to a female patient, or you can take your, I don't know, a father can take his daughter's teeth, and this could be fine.
Yeah, I've had, you know, I'm a smile donator for the DSD app and for DSD in general, and I've had people send me my teeth on a woman before.
Yeah.
Very cool to see, and I've seen it on men, I've seen it on women. Really, really cool to see, and it's totally true.
Yeah, and the other concept that was really nice to see was that we were all trained to choose square, rectangular, oval, or triangular teeth for our patients. And we were all trained basically to give these indications to the technician. What type of teeth should the technician make? Years ago, of course, before the whole digital world came, we know that we can just copy teeth from anybody. But even though now people were still thinking that you should give that kind of form to the patients. The interesting concept is that we realized that most of the teeth were not pure forms, were not square, rectangular, or triangular, oval. They were mixed.
Right.
And this was showing me why most of the veneers or crowns were looking like veneers and crowns and not like natural teeth, because they were too oval or too square or too triangular. And teeth are not like that. We got around 8%, if I don't remember wrong, 3 or 4% of pure forms, so which was nothing.
Yeah.
So it's basically really rare to see somebody with really pure oval or square or triangular teeth. It's really rare.
And to see it on every tooth. So you can do,
Yeah.
you can have different laterals and different centrals. You know, one can be square, one can be oval. I remember seeing that years ago when Florin Kofar presented, where he would take centrals from one patient, one lateral from another patient, one lateral from a different patient, and put these all together. And it's kind of like an art curator, you know, put these different shapes together, and it just fit, and it just fit the face and looked natural. And like you said, it didn't look like veneers or implants or crowns.
Yeah, they were looking like teeth.
Yes, and I always say that too, that I never want my patients to go to for their friends to say, "Oh, I love your implants," or "I love your veneers."
Exactly.
You know,
Well,
you
some
want them
people
to
do.
say,
Some people like it.
"That's true. That's true."
Yeah.
You want them to say like, "Oh, did you go on vacation? You look great. You look natural. You look happy. You have a beautiful smile."
Yeah, exactly. You have a beautiful smile. Or you did something. I mean, you did something in your face. Did you get a nose job or
Right.
fillers, Botox, but actually they got the teeth. Yeah.
Right.
Yeah.
So
Yeah.
what are you most excited about for the Orofacial Club meeting?
Yeah, probably that there has never been a meeting like this before. That we are realizing that the face is really relevant, and it's so easy now with the technology to get that done. I mean, new concepts are raising, and they are starting since really recent times. And for so many years, things were in a certain way, and now we realize that they were different. I mean, and this is changing, and this is the only way to go now, because now, in addition, technology allow us to do these things. And what I'm always saying to the younger students or younger people that join us in courses and lectures, that they are really disappointed and frustrated that the world became so difficult, that most of the countries are oversaturated with dentists, and the DSOs are not paying them enough, or they don't get patients in their private practices. But I'm telling them that it is a fantastic time when we're living now, because we can do things that were never done before in dentistry. So it
it's
is
really
true
an
that
exciting time. You're right. And I say that a bunch too. It's an exciting time to be a dentist. There are certain difficulties now that there weren't before, but there's things now that are much easier. And I think from the clinical side, and like you said, that's a good point. The environment may be more difficult of the business of dentistry, but the clinical aspect is the best it's ever been, and the most predictable, and the least invasive, and the most natural. So, and I think that's something that, you know, me, you, and Bruno, and Christian are all big fans of. I'm excited. I'm excited to see what our consensus is going to be at the end. And it may take us a few weeks to come up with it, I'm sure, or months, who knows. But to get all that information, have everything from the plastic surgeons talking about noses and cheeks and eyes, and you know, and Octavio talking about, you know, moving the jaw and in conjunction with lips, and I'm just excited to get some more input for me as a, you know, as a student, to go there to sit through these lectures.
Yeah, definitely. We will have a huge benefit from all the other guys. Yeah. And I mean, and what I said before. So of course, 20 years ago, and this is what everybody regrets, that was born now in the world of dentistry, that 20, 30 years ago was so easy for the dentist to get a good standard of living. But on the same side, it was kind of frustrating because you could not really correct things. So of course you could put teeth together and you could do a crown if a tooth was broken, but it was never really beautiful. But the standard of living was easier. Now, of course, there is
Right.
more competition, but it is in our hand to make the difference with the others. And if we are capable to make a difference based on what we're doing, then we're going to have a good life anyway. I mean,
Yeah.
the door is open. We just need to enter it.
Right. And patients understand, they see
Yeah.
when a doctor really cares and is passionate about what they're doing, and if they know what
Yeah.
they're talking about. And the patients that are going to these fast offices where they're just being sold on things, they eventually learn, I think.
Yeah. Yeah, definitely. Yeah. Yeah. Yeah.
And
And I mean, well,
we get a lot of patients that will go to, some of these faster offices. Unfortunately, they have a bad experience, and then they
yeah.
come to us and kind of realize, okay, I understand why it's more expensive, why it takes more time. I get it now.
Yeah. Yeah. Well, that happens everywhere. I mean, in Chile, we see Groupons
Mm-hmm.
of bleaching, X-ray, Groupon of, I don't know, free consultation and X-rays and bleaching for $50,
Yeah.
not even 100, I believe. I mean, and of course, then the patients get the bad experience, and then they realize that, well, that nothing is for free.
Yeah.
And then, of course, at the end, it's more expensive.
Yeah.
Well, they will have to pay for a good planned treatment, sadly.
Right.
Yeah.
What's some new research that you're excited about that maybe is coming soon?
Yeah. Well, we have to bring well, let's talk about what is related to what we just discussed.
Yeah.
The one about the natural smile and the videos and the spontaneous smile. Basically, what we did there is to show that it is natural to show gingiva, and the videos are much better, of course, to diagnose that. But now we need to see exactly the boundaries and how much is fine and how much people really like. So this
Yeah.
is something that needs to come now afterwards.
Right.
Probably make a new classification based on that. But this is definitely the next logical study. So
Yeah.
we proved that showing 2 millimeters is just normal.
Mm-hmm.
60% of the young girls are doing that,
Mm-hmm.
and 45% of the young guys. So now we need to prove, I mean, how much like.
Yeah. How far we can take it. Yeah. Yeah.
Exactly.
And
Yeah. Yeah. And when most of the people don't like it, although teeth might be properly aligned and might look beautiful.
yeah.
Then probably about well, based on the other study about the tooth forms, I have some idea because I have asked, but it's not a real official study yet, which are the tooth forms or the type of teeth that really people prefer.
Mm-hmm.
But in an interview of really a lot of several hundreds of people, not just
Yeah.
10 or 20 people or 100 people, several hundreds needs to be done.
Yeah.
Probably the next logical study.
Yeah. This is an interesting topic because I know so many lab technicians have their style, right?
Yeah.
And they do the same smile for everybody.
Yeah.
And
Yeah,
even
that,
some of the most famous lab technicians, oftentimes you can look at the case and say, oh, that's this person or this person.
You see the signature. Yeah, you see the
Yep.
signature. Yeah.
Yeah.
Well, and by the way, these are very beautiful teeth, what they do.
Exactly. But it's nice to, it'll be interesting to see what the lay people prefer. Not the
Yeah.
dental brain, not the lab technician's brain, but
Yeah.
a natural, an engineer or a teacher or a construction worker or
Yeah.
a stay-at-home mom or a stay-at-home dad, and to see what they have a natural feeling about, right off the bat, what instantly they're drawn to.
Yeah. Well, that's basically, this is unlimited. I mean, we could discuss if the Americans or the South Americans
Yep.
would like something different.
Yeah.
Or we know that Americans will tend to prefer teeth that are kind of more even, so
Mm-hmm.
Hollywood style,
Which
so
I hate.
centrals and laterals and canines that are not really individual.
Right.
Europeans tend to prefer rather longer and more predominant centrals with smaller laterals and more predominant canines. We
Mm-hmm.
South America are kind of in the middle, but we don't really know for sure. We don't
Yeah.
really know that.
Yeah.
It's just I'm guessing based on my experience, but we don't really know.
Yeah. Well, I think when our research group gets together, we have our Skype calls, our WhatsApp calls, our WhatsApp groups, and everything. But when we get together in Miami, I'm excited to see where our brain starts to flow, because the last time we did this, just in a few hours, we got a lot done,
Yeah,
and came up with a bunch of new ideas, collaborated on certain people's ideas, and helped each other out and helped to define some things. So I'm excited. I'm excited just to hang out with everybody too.
yeah, we're gonna have fun, definitely.
Yeah.
Yeah. And then next time we can talk about the other things. I mean, we just focus on what we're gonna do during the next 2 weeks, but there are so
Right.
many other topics. Like, I mean, composites is endless. What's happening with ceramics? So I'm
Yeah.
working now on a project to see how relevant are cements. I mean, there are many companies pushing that you can do a lot of with cements, changing the
Mm-hmm.
value or the chroma of
Right.
veneers when you make one or two. And I have seen things that are, or how relevant it is to make a dry try-in, or you really need to buy the expensive try-in paste.
Yeah.
Do you really need them? Can you make just water try-in or just
Right.
any cheap glycerin
Yep.
neutral color paste? Or is it
Mm-hmm.
really relevant to buy the more chromatic or the less chromatic try-in paste, and will they correlate with the final cement? I mean, this is a huge topic.
Yeah. Yeah.
Yeah,
Well, we gotta come back on Instagram and talk about it again.
yeah, definitely. Definitely. This is something that I need to show you that before a few slides
Mm-hmm.
because it's really crazy. I was busy a couple of months with that, and also what's
Very
going
interesting.
on with the concepts of colors and value. If the A to D system is still valid, or it's
Mm-hmm.
kind of old school, and now the value systems are taking over. I
Right.
mean, there are so many things that are so nice to discuss now.
Yeah. Well, yeah, I know Pascal, he always told us, Pascal Magne, he always told us that really shape is number one,
Yeah.
value is number two. And if you get those two, you can kind of screw up the other ones, and most people don't know.
Yeah. Yeah, or the discussion that we have recently, you remember that in our WhatsApp that somebody
Mm-hmm.
asked what was going, why he was getting, whenever he was cementing a kind of thinner crown or a veneer,
Yeah.
making the twine, it was beautiful and great, and then 2 weeks
Mm-hmm.
after the patient comes back and it looks grayish.
Right.
I mean, that happened to everybody of us.
Yep. Yeah.
Everybody. I mean, and if it didn't happen to you, it's because you have not done enough. It's
You haven't
very
done
simple.
enough. Yeah.
It's very simple. Yeah, and I mean, and this started a huge discussion with guys that have been really long time working,
Yeah.
and we all had our ideas and our experiences. This was so valuable for all of us.
Completely. Yeah,
Yeah,
whenever we can get other people's experiences, especially people that have much more experience than us,
yeah,
I just love listening.
yeah, yeah, exactly.
I'm
Yeah,
an
so we should
eternal
definitely talk
student.
about that. This is another conversation for another day. Yeah,
Yeah, yeah. Well, good. Thanks for coming on. I'm excited
yeah,
to
Carlos.
see your lecture in
Yeah,
Miami. And again, for those that are watching, Eduardo and myself are going to be at the Orofacial Club meeting in Miami, June 14th and 15th. So you
yeah,
can just go to digitalsmiledesign.com. You can register on there. We're bringing together plastic surgery and dentistry and orthodontics and orthodontic surgeons all in the same meeting to see how we can learn from each other and to really think about the face. And the theme of the symposium is dentists learning about the face and plastic surgeons learning about the smile, because there's been a disconnect. And so that's what we're trying to do with our group, with our research group, with our group of friends. So I'm excited to see you there. I'm excited to hang
Yeah,
out.
we're gonna have a lot of fun.
Yeah, we'll have some fun. And thanks for coming on. I know it's late in
Yeah, thank
Santiago.
you for the invitation. I'm gonna go to sleep now. Yeah,
Okay.
definitely. Yeah, you still have a few hours more of your day, of your Memorial Day. Yeah,
Yes.
but for us, it really ended. Yeah.
Yeah, that's a good point. You know, I should say that we're giving thanks in the United States for all of the people in the military that have died. So very,
Yeah.
very important holiday here in the United States that is oftentimes overlooked for,
Yeah.
you know, barbecues and things. But you know, I come from a military family. Both of my grandparents were
Yeah.
in the military. So yes,
Yeah.
yes,
Well, I was honored that doing Murph today, just 2 hours ago. And it
yes.
was fun, but it was tough. Yeah, because I live on a hill. I mean, on the first mile run and the last mile run I did it with the vest,
Yeah, 20 pounds, is
and
that
it's
what it
really
is?
going up and down. It's tough.
It's 20-pound vest, right?
It's 20 pound, I guess
Are you
it's
trying to
20
figure it
kilos.
out in
Yeah, no,
kilos?
no, it's 16 pounds or
16
14
pounds?
pounds.
Okay.
Yeah.
Yeah. I did the Murph challenge too, but I didn't have a weighted vest. So I don't know
You
if I can
carry your
really.
kit.
Yeah. Yeah, we thought about doing the squats with our kids. So me and
Yeah.
a few friends did that as well. So yeah,
Yeah, cool.
in honor of those who have died.
Yeah,
Yeah.
great. Yeah,
Well,
guys.
thanks so much.
Yeah.
See you in a
Okay.
few weeks, and thanks everybody
See you
for
in a few weeks.
watching. Have a good
Yeah.
night.
See you next time. Yeah, bye bye, my friend. Bye.